All right, this is part one of my elbow eval. I'm going to hit the history, observation, and palpation in this video. Let's kick it off with history. Chief complaint, tell me about the problem. After the chief complaint, we're going to do location. So point with one spot where the symptoms most severe. Are there any other spots? After that, we're going to look at the symptom characteristics. So characterize the pain. Dull, throbbing, aching. Does it radiate? If so, where? What increased the pain? What decreases the pain? How do these symptoms affect your activity level? Do you have any other symptoms? So tingling, hot, cold, and is your arm heavy or weak after activity? Next, we're going to look at participation. So what sport do you play? What position do you play? The frequency, intensity, duration. Could equipment affect the symptoms? What type of warm-up do you have? What's your occupation? And what is your hand dominance? Okay, now we're going to move into observation. So this I'm going to compare bilaterally. I'm going to look anterior, posterior, laterally. We're going to look at swelling, discoloration, deformity, body motion, scars, lacerations, hematomas, muscle spasm, the patient's facial expression. Are they favoring one limb more than the other? The position of the limb. We're going to look at cubital valgus, so that's greater than 15 degrees. Cubital varus, less than 5. The cubital fossa, so right in here. The medial border is the pronator teres. Lateral border is the brachioradialis. And the superior border is the line across from the epicondyles. We're then going to look at the gunstock deformity. So posterior dislocation, the olecranon process, and then the hypertrophy, atrophy of the muscle. So now we're going to get into palpation here. We'll set you up a little closer, featuring my brother Andrew.
Hello.
Okay, so start us off here. Palpation. So the first things we're going to look at, we're going to compare bilaterally. We're going to look at swelling, skin temperature, skin texture, muscle spasm, edema, crepitus, lumps. Now we're going to look at, so we'll use his right arm here, the lateral supracondyle ridge. So that's going to be the lateral posterior aspect right above the epicondyle here. We're going to look at the radial fossa. So that's going to be the divot on the lateral side above the radial head. The capitulum is going to be right above the radial head. This is what articulates with the radial head. We have the humeral shaft up here, the cuboid, or the coronoid fossa. So that's going to be the divot on the medial side above the elbow joint, right in the middle there. We have the medial epicondyle right there, the lateral epicondyle right here. We have the trochlea, so it's going to be like either side of the olecranon, and then we have the olecranon. The radial notch, which is going to be right in the middle here, like right next to the radial head. Then we have the radial head, so it's right laterally to it. It's also, you could just grab the brachioradialis and feel for it underneath there. We have the radial tuberosity, so that's going to be right on the lateral side as well. That's where the bicep brachii inserts. We have the radial shaft, so all the way down here to the radiostyloid process, the bony prominence near the wrist there. Semilunar notch, so that's going to be in between the radial head and the ulna up at the front here. We have the coronoid process, so that's going to be right in the middle below the elbow joint. So when you go up, it goes into the coronoid fossa up above. We have the ulnar shaft along the outside, the ulnar styloid process, the bony prominence right there, the ulnar collateral ligament or the MCL, UCL. The radiocollateral ligament on the outside here. The annular ligament comes across, entraps the radial head, and the supinator, it's gonna be 4 fingers down, right in the middle. It does the supination. Okay, so we're gonna come back for part 2.